Let us have a look at the coronary arteries. There are two main coronary arteries, the left and the right. Now, these are the coronary arteries, the left and the right. Let us study their branches and their distribution in detail. Now, the left main coronary artery supplies blood to the left side of the heart muscle, that is, the left ventricle and left atrium. The left main coronary divides into branches. What are they? The left anterior descending artery. Now, this branches off the left coronary artery and supplies blood to the front side of the heart, the left anterior descending artery. Then we have the circumflex artery, which branches off the left coronary artery and encircles the heart muscle. This artery supplies blood to the outer side and back of the heart. The left anterior descending coronary artery is the main artery that gets blocked, resulting in death, leaving behind a widow, and therefore called the Widowmaker. What is a Widowmaker heart attack? A Widowmaker heart attack is a type of heart attack that's caused by a 100% blockage of the left anterior descending. The left anterior descending artery is the most commonly occluded of the coronary arteries. It provides the main blood supply to the interventricular septum and thus bundle branches of the conducting mechanism. Therefore, blockage of this artery due to coronary artery disease can lead to impairment or death of the conducting system. The result is a block of impulse conduction between the atria and the ventricles, known as right or left bundle branch block, and a total blockage of the left anterior descending artery eventually leads to death, therefore called the Widowmaker artery. This, let us have a look, is the anterior descending artery, and this is almost 95% blocked. The incredible doctors, what do? They open up by putting in a stent, and as a consequence of which, blood supply is restored and a heart attack avoided. This is the left anterior descending artery, and this is the one that most often gets blocked, the left and the right coronary artery. Now let us have a look at the right coronary artery. The right coronary artery supplies blood to the right ventricle, the right atrium, and the SA and AV nodes. Now, these nodes regulate the heart rhythm. The right coronary artery divides into smaller branches, including the right posterior descending artery and the acute marginal artery. And together with the left anterior descending artery, the right coronary artery helps supply blood to the middle or the septum of the heart. The posterior interventricular artery, often also called the posterior descending artery, is an artery running in the posterior interventricular sulcus to the apex of the heart, where it meets with the anterior interventricular artery, also known as the left anterior descending artery. This supplies the posterior third of the interventricular septum. We will see a detailed description later. Now, the remaining anterior two-thirds is supplied by the anterior interventricular artery, which is a septal branch of the left anterior descending, and this is a branch of the left coronary. Now, this is the right coronary, that is the left coronary, and from it branches off the left anterior descending artery, from which arise the diagonal branches. This bifurcates and turns around the heart, and that is called the circumflex artery, the left circumflex. So what are the two main branches of the left coronary? Is the left anterior descending and the left circumflex. On the right side, it is the right coronary artery that descends down, turns at the margin, passes backwards, and then branches off as the posterior descending artery. Now, before it does that, it gives off a branch, and this is called the right marginal artery. So, it's very simple, the right coronary and the left coronary. The right coronary gives off the right marginal and then passes backwards as the posterior, as the right coronary artery passes backwards and gives off a branch, the posterior descending artery. Now let's have a look at the right marginal artery, this one. The right marginal artery is a branch of the right coronary. It branches off at the inferior border of the heart, passes to the left, and as it passes horizontally, branches and tapers along its route and primarily supplies the right ventricle, the right marginal branch of the right coronary. These are the right and the left coronaries, and as we said, this is the Widowmaker, the anterior descending, and then it passes forwards as the circumflex passes to the back of the heart and supplies these vessels, whereas the right coronary gives off the right marginal artery and then passes backwards to supply the posterior aspect of the heart, and this is the posterior descending artery. Again, the right coronary, the right marginal, and passes backwards and the posterior descending. On the left is the anterior descending, which gives off the diagonal branches, and then the left circumflex that passes to the posterior aspect of the heart. Let us expand that on a bit. This is the left circumflex artery, which passes branches from the left coronary, and this supplies blood to the left atrium and posterior aspect of the left ventricle, the circumflex artery, whereas the right coronary descends and then gives off the right marginal. Why is it called coronary? Look at the crown in this ancient picture, giving rise to the impression of a crown, and therefore the same picture here in the heart, it looks like a crown, from which we get the word crown or coronary arteries or coronary care unit or ICU. Now here we have the distribution to the various parts of the heart. To the inferior aspect of the heart is the right coronary. The anteroseptal region is supplied by the left anterior descending. The anteroapical is supplied by the left anterior descending, the distal part of it. The anterolateral aspect, as you have seen earlier, is supplied by the left circumflex, whereas the posterior aspect of the heart is supplied by the right coronary. Where do these arise from? This is the aorta, and here we have the origin of the right coronary, and here we have the origin of the left coronary. They arise from coronary sinuses just above the aortic valves. Look at this. These are the right and left sinuses, and we have the left coronary artery passing across the pulmonary artery, gives off the circumflex, and then comes down as the left anterior descending. This is the Widowmaker. The right coronary artery arises from this sinus and then passes down, gives off the marginal branch, and then passes behind the heart. These are the openings of the right and left coronary arteries, the ostia of these arteries at the start of the aorta. Now, the right coronary artery passes at first anteriorly and slightly to the right between the right atrial appendage and pulmonary trunk, where the sinus usually bulges. On reaching the atrioventricular groove, it descends almost vertically to the right cardiac border, curving around it, as you have seen earlier, into the posterior part of the groove, where the latter approaches its junction with both interatrial and interventricular grooves. Then this is called the cardiac crux. The artery ends a little to the left of the crux, often by anastomosing with the circumflex branch of the left coronary artery, and therefore there is a anastomosis or a shaking of the hands between the right and the left, permitting thereby blood supply to continue if one side is partially blocked. Now, this is the right coronary artery. It descends down between the atrium and the ventricle and then gives off, as we earlier saw, the right marginal artery. After that, it turns behind and gives off the posterior descending artery. Whereas this is the left coronary, which gives off the anterior descending and then the circumflex artery. It descends, the right coronary descends almost vertically to the right cardiac border, curves around it into the posterior part of the groove, where it approaches its junction with both the interatrial and interventricular grooves. And this is at this point called the cardiac crux. It turns backwards into the groove and then passes forwards to anastomose with terminal branches of the circumflex. This is just above the aorta, and this is the origin of the right coronary artery, the sinus where it opens. This shows the vascular architecture, the right coronary and then the right marginal, and then passes backwards and then gives off the posterior descending artery. Now, a wonderful picture here, the right coronary descending downwards between the atrium and the ventricle and then gives off the marginal branch and passes backwards behind the heart, this particular vessel, whereas the left gives off the anterior descending, which gives off the diagonal branches and then turns around into the back part of the heart as the circumflex artery. Now, the right marginal artery, this one, is a branch of the right coronary, branching off at the inferior border of the heart and passes to the left towards the apex. This right marginal artery, it passes horizontally, branching and tapering along its route and supplies the right ventricle. This is the aorta, and arising from it is the left coronary here, giving off the circumflex there, and then we have the right coronary arising from here, and then which gives off later on the marginal branch. A bit about the left coronary. The left coronary artery is usually larger in caliber than the right. It supplies a great volume of myocardium, including almost all of the left ventricle and atrium, and most of the interventricular septum. In hearts with the right dominance, the right coronary supplies a variable posterior region of the left ventricle. Now, the left anterior descending artery typically branches into the diagonal arteries. This is the left anterior descending, which branches into the diagonal artery, the deep septal perforators, and the left descending artery. Again, the left anterior descending gives off the diagonal arteries, it gives a deep septal perforator, and then continues as the left anterior descending artery. This left anterior descending artery branches into the, as I said earlier, the diagonal arteries, the deep septal perforators, and the left descending septal artery. Although there is a high amount of variation in the course of diagonal arteries, they typically branch off at an angle. The diagonal arteries branching off at an angle and supply the free wall of the left ventricle. This is again the same picture highlighted again, the left coronal artery arising from the left sinus and then turning around the pulmonary artery. Whereas this is the right coronary, it gives off the right marginal branch here. The circumflex, the left coronary, after giving off the left anterior descending, turns around and passes to the back of the heart, this one. Now the circumflex artery continues along the atrioventricular groove until it terminates at the cardiac crux, where it branches into the artery that supplies the atrioventricular node and the inferior interventricular artery, traditionally known as the posterior interventricular artery. The right coronary artery, the left coronary artery, the left anterior descending, the left circumflex, the left circumflex. The circumflex artery branches off the left coronary and supplies most of the left atrium. The posterior and lateral free walls of the left atrium and part of the anterior papillary muscle. The circumflex artery may give off a variable number of left marginal branches to supply the left ventricle. The terminal branch is usually the largest of these branches, and more likely the circumflex artery may continue through the AV sulcus to supply the posterior wall of the left ventricle and the posterior papillary muscle of the bicuspid valve. The left circumflex branches decrease in diameter along their length. Now this is a 3D CT scan, and this shows the absent left circumflex artery. Sometimes the left circumflex is absent. Only the left anterior descending is present. Now this shows the sulcus in which it should have been present but absent in this case. And now there is only a single anterior descending artery. The single anterior descending artery and prominent diagonal branches. The anterior descending gives off diagonal branches, and this is one of them. These are the diagonal branches. However, the left circumflex is absent. So now we have a very clear picture. This is the right coronary, the atrial branch, and then it gives off the acute marginal branch and then passes to the back of the heart where it gives off the posterior descending artery. However, on the left is the left main coronary artery, which descends as the anterior descending artery and then gives off the circumflex. Now here we have an interesting picture that shows when a part of the heart is damaged or ischemic, where the waves will manifest. If This is the area involved, the anterior part, the left anterior descending artery. The changes are seen in ECG leads V1, V2, V3, V4. If the anterior wall has undergone ischemia, then the waves are manifest in V3, V4. If the lateral wall is injured, then the waves lead 1, AVL, V5, V6. And when is that injured? When the circumflex artery, the left circumflex artery, is blocked. As a consequence of the right anterior descending artery, as a consequence of blockage to the posterior descending artery, which is a branch of the right coronary, then this part of the heart is damaged, and therefore the changes are seen in lead 2, 3, and AVF. Now, this I said is the Widowmaker, and this, if it is blocked, the changes are seen from lead V1 to V6. If the left circumflex is blocked, then the changes are seen in 1 AVL and the lateral part of it, which is seen in lead V5 and V6. If the right coronary artery is blocked, the damage is here, and the changes are manifest in lead 2, 3, and AVF. An interesting correlate of where various vessels are blocked and where changes in the ECG is manifest. A comprehensive discussion about various arteries that supply the heart and the consequences thereof when it gets blocked.